You're still watching TVC Breakfast. Now, the federal government is stepping up health checks at Nigeria's borders following an Ebola outbreak in the Democratic Republic of Congo. Now, over 20 cases and more than 10 deaths have been confirmed in the DRC Congo as Ebola spreads through direct contact with infected body fluids or animals like fruit bats. Dr. Akpaninse of the Ministry of Health says extra staff are now in place to boost surveillance. He reassures that while Nigeria is at risk due to travel links with Congo, Port Health Services is fully on alert to keep the country safe. Now, joining us in the studio for this conversation is a medical doctor, Tui Mebawandu. Good morning. How are you? How is it going? And, you know, I'm really happy that you are the one that's going to talk about this because you're very vast when it comes to this, and you're a medical doctor as well. You know, we're talking about Ebola. We've seen the outbreak. We've seen the dangers of Ebola. We've seen how it kills fast, you know. And now we're seeing that it's coming back again. And what we're hearing is that, oh, borders and all of that. But what I want to speak on is, do we need to do more than that? Because we know that up till now, there's no vaccination for Ebola. I'm wondering, why have we not gotten a vaccination for it? And what do we need to do more than just tightening the borders?
Interestingly, that's the 16th outbreak in Democratic Republic of Congo. Between 1976 and now, we've had about 34,000 cases of Ebola, viral diseases, and we've recorded about 15,000 deaths. So that's substantial. If you, depending on your calculation, the world has lost between 2.8 and $30 billion from Ebola outbreak. Then the question you want to ask yourself is that, why DR Congo? Why is it that consistently we are seeing this epidemic, you know, breaking forth in DR Congo? Now, it speaks to the intersections of so many things as far as health is concerned. DR Congo, the second biggest rainforest in the world. DR Congo, the number 5 extremely poor country in the whole world. Poverty is reigning. Yeah. There's war. There you see the intersection of poverty, war, and diseases. The health system is broken. DR Congo, you see a lot of people doing mining, felling trees, encroaching on the climate and the rainforest. So there's always been that constant contact between the animals, the fruit bat, which is a reservoir for this virus, and humans. So then, if you look at the socio-cultural imperatives, the people have to do their burial in certain ways, and then you cannot take them away from it. Yeah. There's a distrust, because the health system is broken, there's a distrust of the health system. So that created an environment to cook recurrent epidemics, not just Ebola, whether you call it cholera, you know, and so many other diseases have been, measles, being cooked, malaria, they're being cooked in DR Congo because of that kind of. So now, at our level, we're trying to do border surveillance, excellent. Now, most of the time in the past, this border surveillance is funded by a lot of organizations, including WHO, American, the Global Health Security. American contributes a lot of billions of dollars to global health security. Donald Trump stopped that. The USAID has been decommissioned. So here we are, we're faced with our own limited resources and how to deal with this. Now, surveillance is actually one of the great things you can do, but you cannot stop the birds from flying from DR Congo to Nigeria.
To Nigeria, yes.
I remember in University of Ife, we saw those birds that used to migrate from South America to Ife every year, and they stay there for about a month or 1.5 before going back. So you can't stop that. Then you can't stop that interaction from happening. It's good to talk at this level, to, you know, keep signaling, talking to people what they need to do. That's excellent. But beyond that, we need to put boots on the ground. Now, case identification, we have to actually strengthen it, talk to people, and then those contributing factors, because we are not saying that health is not, you know, managed in silos. Health is a complex thing. The One Health policy means that the challenges of human, animal, and environment must be looked into.
Yeah. Okay.
You cannot keep driving climate changes and think that you're not going to have outbreak of diseases. You cannot, you know, neglect nutrition. I think you're not going to have, that's agriculture, and I think you're not going to have malnutrition.
Yes.
Okay, which is also, you know, the fermenting point of all sorts of illnesses. So now health has moved away from building many hospitals. Even if you have to put a lot of human resources into addressing the health challenge of Ebola, you have to address the challenges of behavioral communication and insight. You have to address the socio-cultural condition perpetuating the Ebola. So many things you have to address the issue of climate change and how to relate to the climate. And even in recent conversation, at least from at the level of WHO, the conference I just came back from, we don't think there's a natural disaster again. All disasters are caused by humans.
Yes, humans. Yeah.
So you cannot wake up and say, "Oh, it's a natural disaster." Those are political speak. You are just trying to, romanticize the problem and create a kind of negligence. So that's the challenge. I agree that we have to do our border. We have to keep signaling, alerting people. But at the same time, we need to go beyond that.
Now, go beyond that is what I would like to know. What are the beyonds that we're supposed to go, number one? And then number two, we have gone through this before in Nigeria, and I want to commend the Commissioner for Health at that time when the first case came in Nigeria, in Lagos. So many strategies were put in place that worked, and it could be contained. Do we still remember those strategies? Are they still relevant now? And if we happen to find one person in Nigeria, how dangerous can that be?
Indeed, quite dangerous. But the beauty is that the first case of Ebola then came to Lagos, and the present head of Nigeria Center for Disease Control, Dr. Jide Idris,
that's his name, yes.
The Commissioner for Health. So
yes.
He's an experienced hand. He has a lot of institutional memory and knowledge in terms of managing cases like this. Apart from that, he's managed a lot of cases of cholera, outbreak in Lagos, and so many things. So he was there for a long time, and then now he's the head of NC, Nigeria Center for Disease Control. So I expect a more robust planning, a more robust engagement, how to really deal with those outbreaks. But at the same time, the things are not the same again. Because, for instance, whereas we used to have a lot of leverages in terms of funding from the bilateral and multilateral institutions, but now we're constrained. We don't have those sort of funds. In fact, indeed, clearly it was seen that even Donald Trump was reducing money going to Global Alliance of Vaccine Initiative, Gavi. So if we are not getting funded, because health is just about the funding. So if you are not getting funded, then you have to actually stimulate the West Africa initiative to collaborate, to look at how to network in area of surveillance, in area of other issues that is relating to not just Ebola, but transmission of a lot of diseases, going around Africa. You have to talk to climate change. You have to educate people. The low-hanging fruit for us is actually the education, the health literacy, which we need to improve. And you can see a lot of damages the negative health information is doing to even your intervention. Yeah. We saw what it did at the level of COVID. It's going to still come up when we're dealing with this. So our low-hanging fruit is to deepen communication, to deepen insight, to deepen behavioral modification that can help us address this challenge.
That's right.
So health is not just now about
hospitals,
building a hospital and thinking that you're going to be giving injections. It's gone beyond that, because in reality, when there's war, expect famine, expect displacement, expect diseases, So that is where we are now.
Right, Dr. Mebamodu. Now, it's good that we've talked about, the issues of, this thing, there's an outbreak of it in DR Congo, which is not new, as you said, 16th time. But Nigeria, is one thing that's been isolated. We're trying to remember Dr. Ameyo Adadevo, Stella Adadevo, who died as a result of that. But we have other activities. You talked about behavioral. If you go to, I don't know how to describe it, hinterlands, it go to all those places, those places where they do gari, and all of that, and then you see the gari crumbs, on the side of the roads, being displayed, being spread there for it to dry. And we have animals, because we are tightening our borders against humans. Forgetting that, that animals cross borders without checks. So from DR Congo down to Niger, down, and then finally, God forbid, Nigeria. And this is animal to human, transmission. How do you think we can, leverage on it? Because I do not know how we can stop animals, monkeys, from jumping borders.
It's multi-sectoral. And multidisciplinary. We don't deal with that in silos again, and that's why in reality, you have to bring your agricultural people into the picture. Now, indeed, what we need to do actually is to take some animals and do samples of the virus inside those animals. That's how you really know that it's not just by human and waiting to know it gets to human. So agricultural people in the environment, the traditional institutions at the local government, and then you have to, because the agricultural people now tell you the practice, and the basic interaction with the animal, because you don't want their semen,
their feces,
fluids, bloody fluid to touch you, when you are even, killing those animals. So at that point, it's not the health people that will be discussing with the locals. It is the agricultural people, it is the environmental people, it is the behavioral change inside people that will be discussing. So we have to raise that multi-sectorial group that can address this. Or else, what applied then, when we lost our Daredevil, may have so rest in peace, may be challenged now. Because when you see, and what you've seen is that the level of poverty in the country is increasing. The health system is barely trusted now as it is, because we have a lot of stories coming from the health system. We have to really speak to those things, and here you are. If information is mismanaged, especially health information, health literacy, if it is mismanaged, we run into trouble. So the whole spectrum of how we are, how we got to where we are, it goes beyond you just building the health institutions. There are supportive things that must happen. You must provide water if you want to prevent cholera. And I don't think any hospital provides water. It's not, the function lies within the water ministry to ensure that the water flow and all those kind of things. So now, if I'm waiting to get cholera before I start reacting, then it may be too late.
Maybe too late. And Dr. Tuya, I definitely love where you're coming from, but I want to speak about the fact that you said something that we don't have natural disasters anymore. They are human-made disasters. Indeed. So I want to ask you, because there are a lot of conversations that even coronavirus was a human-made. I just want you to clarify for us today.
In a sense that, you see, it's still the same breaching of the space between wild animal and humans. Because when an epidemic is to happen, the first thing is what we call zoonotic spark. And the jump happens either from domesticated animal or wild animal to human. And then human use that human to transmit it to other people. So coronavirus in that regard is actually a breach of the protocol that was supposed to be in between the animals, whether the bats or whatever, and humans.
So now let's go back to Ebola that we're speaking about. You said something about the fact that, these bats, we cannot stop them, or these animals, we cannot stop them. But right now, it seems that we are focusing our attention on just closing the borders and not even thinking about the animals, like you said, which is very important. So in what ways can we really make sure that we don't just only focus on one side and leave, I would say, the most important side?
Again, I agree. You may want to say, okay, are you coming to Nigeria? That was why we called the first Ebola that came to Nigeria from, whether I said Sierra Leone or there. Yes, you do that syndromic check. The high fever, which is, of course, one of the key things, the high fever, the headache, the body ache, you do that syndromic check.
But you can link that to malaria.
Indeed, well, the person is a risk first, you have to check. But again, it's tough. Where do you get the laboratory to start isolating people?
Exactly.
So, of course, the confirmation is easier, but where do we get the laboratory? Where the laboratory? A typical private settings may not have the ability, but we have to still stick to our personal preventive equipment and infection prevention control method at both the hospital. And of course, that one should be heightened now. Nigeria Center for Disease Control should heighten that, that everybody, every Ministry of Health in all the states should heighten that look, every hospital, raise your infection prevention control method. It's still the same hand washing, it's still the same wearing protective instrument. Yeah. There are 5 rules that guides you handling patient. Go back to those things and ensure that you handle patient. Because among the death, recent outbreak, among the death are for health workers. So you can't then wake up and be losing health workers to Ebola.
And at the end of the day, they get it fast.
And then we become a veritable, medium to transmit this virus from one person, from us to other person. So we have to actually tidy that. But again, those things are even costly.
I was going to go to that, Mr. Chuyi. What
there's
about
no water.
Vaccines?
There's
a vaccine. Have we thought about vaccines?
Yeah, there are vaccines, but again, we have to look up to Gavi. They're not getting much fund now. We have to find a way to get the vaccines and do what we call ring vaccination. You cannot just wake up and start vaccinating everybody. It's called ring vaccination. You pick a case here, you vaccinate around the case, so that at the end of the day, you have some semblance of peace with it.
We have very big investors, international investors that are Nigerians. We have some of the most brilliant medical minds in the world are Nigerians. And it is so disheartening that we don't have a laboratory that is good enough, that is strong enough to come up with vaccines locally. You know, I think it was the coronavirus thing. That was when it became so clear that Nigeria doesn't have a good standard international level laboratory to troubleshoot these things even before they come. It is disheartening, sir.
Are you running the lab as a business, or are you running the lab as a social investment? Now, as a business, it's tough. Government must have to look for the money and pay, or donor must look for the money and pay. Well, some of us, after leaving the Lagos State Government Service, try to do business in health, and it's quite concerning. It could be quite frustrating. You must have a link like $10 to get those things done. So that's one factor. The second factor is that, level 4 laboratory or level 5 laboratory that would cater for that kind of thing actually requires a lot. In fact, the one in Wuhan was built by who? Was built by CDC and French government for China then, 1950 something, yes. Those laboratories they're not just buildings that you push things into. There are a lot of levels that must not be breached. If you breach any of those levels, those germs you are handling will spill into the society, and it will become a problem. So, apart from the lab, you need that kind of human resources. Is it such that even if you have to consider how to power the laboratory itself, you can be discouraged? Because, so there are a lot of things that are feeding into each other. So, but the first thing is that government will wake up and say, look, I am going to make this change happen. Then when government does that and support it, then gradually we move on in that regard. So at the end of the day, laboratory or whatever still stand in the whole comfort of government. In fact, the one we have in Lagos, I think is a level 4 laboratory. Was a big support from the United States there, but I don't know whether they're still supporting it.
But a country that does not take care of its laboratory drugs will have its health status dictated.
Thank you very much. Great insights. We'll definitely have you again to talk more about this. But thank you so much. Good morning to you once again, and thank you. But still ahead on TVC Breakfast, EFCC declares Olashibomi Ogundele, CEO of Sujimoto Luxury Construction Limited, wanted for alleged money laundering and diversion of funds. Despite the allegations, Sujimoto denies any wrongdoing and promises to clear his name. Stay with us.